everyone, it's Dr. Jenny here at Revitalize. Today we're going to be talking about anatomy. So we're going to go through the anatomy of the female pelvis, just to kind of give you an idea of where everything is, what everything is, and then hopefully give you a better understanding of your own pelvic floor. So we're going to start with the bony parts of the pelvis. So we have your hip bones on both sides, and then the pelvis, both sides of it are connected by the pubic symphysis up here in the front by some cartilage. You can get some pain there during pregnancy, postpartum, as the joint kind of separates during childbirth. On the back side, we have the sacrum, and that's kind of the tail end or the continuation of the bony spine. And at the very end, we have your tailbone or your coccyx. So then also, the other thing I want to point out is these two bones right here are your ischiotuberosities or your sit bones. So that's going to be the bony part of your butt that sits on a chair. And we'll get to why those are really important when we get to talking about nerves, but it's important to know where those are. So this is what the pelvic floor looks like from the bottom. So if you were to picture it with skin over it, instead of just the muscles, this sad little broken muscle that we have right there, but you would picture the skin, you're still going to be able to see the three holes. So here you have your urethra, let me use my pen to paint it up, your urethra, your vagina, and then your anus. So those three holes externally are surrounded by lots of other tissue that's typically referred to as the vagina, but technically it's actually called the vulva. So if you were to picture the skin, you're going to have kind of the lips called the labia majora, and then right inside the lips are the labia minora. From there, right up at the top here, this yellow piece, it's visible externally and then also when we get to the next layer of muscle, and that's called the clitoris. And then the next one that we want to go through is down here below the vagina, in between there and the anus. It's called the perineal body. So if you hear of tearing during vaginal childbirth, that's typically the location of the tear is right there in that perineal body. So we're going to chat about nerves quick. So there's a whole lot of nerves, arteries, veins in your pelvis. There's a lot that flows through there. Nerves specifically though, there's a nerve called the pudendal nerve that goes right through the fascia and the muscles right next to the ischiotuberosities. So it's really easy for that nerve to become inflamed or even pinched and irritated as your pelvic floor muscles get over tight or any kind of alignment changes with your pelvis causing compression of that nerve. So, pain with touch or any sort of clothes rubbing against that area of skin is going to be really sensitive if your pudendal nerve is irritated. So the other thing about that is the nerves are right along with most of the arteries. So again, if your pelvic floor muscles get tightened up or compressed, it's also going to compress your arteries, which is going to decrease blood flow to your pelvic floor muscles. When muscles don't get enough blood flow to them, enough oxygen, they tighten up and clench and get really painful and kind of continues over time until you can restore that blood flow. So we went through the openings. So next we're going to take the skin away and look at this first layer of muscles that we have here. So right along here on the kind of across the middle is the superficial transverse perineal muscle. Up along here we have the ischiocavernosus muscle, and then along here we have the bulbospongiosus muscle. So these three muscles are your superficial pelvic floor muscles, and they are a huge part of sexual response of the pelvic floor. So if you have a lot of pain with intercourse, it's possible that these muscles are really tight and, contributing to that issue. So again, you can see there's some glands here, right where this pink dot is. You can again see the clitoris here. And then you can also work your way down towards the anus, and below the perineal body, this ring of muscle is called the external anal sphincter. So that's what allows you voluntary control of your bowels, and so that muscle is really important, but also can get tight, which would contribute to any issues you might have with constipation. So We're gonna go down to the next layer. So this layer you can't really see on the model, but between this layer and the next one, you see the perineal membrane, there's fascia, as well as the muscles that control voluntary, or that are part of voluntary control of your bladder. So those muscles are in the second layer, and they again help with keeping continence, preventing leakage, any sort of that kind of thing. So we're going to take this part off, and so that puts us at the deepest level of the pelvic floor muscles. So here you can see there's a whole lot of muscle all the way around. We still have our 3 openings, the urethra, the vagina, and then the anus. But all this muscle is the deep pelvic floor muscles. So a lot of times we just kind of refer to them as deep pelvic floor muscles. They do have individual names, but they all function as a whole. The big one to think about is called levator ani, so it kind of comes and it slings around the anus, you can see, and that's what, again, helps with more control, voluntary control of your bowels. So the other one I want to point out besides, this big bowl of pelvic floor muscles, is you can see right on the inside of the pelvis, there's a muscle called obturator internus. So that muscle actually functions as part of the pelvic floor, but also does some motions at the hip joint. So that's why sometimes pelvic floor tightness or pain can actually feel like hip pain or back pain, because everything is very closely related, as you can see. The same muscles right in here. It's all very closely related and can refer pain in the surrounding area. So the last thing we're going to talk about is the organs. So if you look into the bowl of the pelvic floor, you're going to see anteriorly up by your pubic bone is your bladder, your uterus and your ovaries on either side, and then in the very back, your rectum back here. So it's kind of a tight space. Everything's definitely got its place, and they all are very close proximity-wise to each other. You've probably heard us talk about prolapse before. That's why it can be such a big issue if any of these organs start to move out of place, because they all are kind of nestled in there perfectly, so when one starts to shift, it can cause issues with the other organs. So I'm going to take the organs out and show you the pelvic floor from inside. So again, you're seeing just that big bowl almost, and it supports all those organs that were just in there, as well as all the contents above it, so your abdominal organs, all that. The other thing I want to point out here is you can see all the muscles kind of attach into that tailbone or that coccyx right there. So tailbone pain is really commonly actually pelvic floor tightness or overactivity, because the muscles get tight, they pull on the tailbone, it could even deviate from midline, depending on how tight the muscles are. So hopefully that helps give you a better idea of the pelvic floor and what your anatomy looks like.